Chemotherapy may cause side effects in the digestive tract, such as nausea, vomiting, diarrhea, or constipation. Many chemotherapy medicines cause nausea and/or vomiting within 24 hours of treatment. This could last for a few days. Prescription medicines and dietary changes may prevent or control nausea and vomiting. Be sure to talk with your healthcare team about these medicines. When you feel nauseous, take your nausea medicine 30 minutes before you eat. This may help you keep your meal down. To reduce nausea, eat small, frequent meals throughout the day. Choose dry foods like toast and crackers, and cold or bland food without a strong odor. Be sure to drink plenty of fluids. Avoid high-fat, hot, and spicy foods. Tell your healthcare team if the medicines are not controlling your nausea and vomiting. If you vomit 4 or more times in one day or are unable to keep fluids down, go to the nearest hospital emergency center. Diarrhea and constipation are very common while on chemotherapy. Depending on the type of chemo you receive, you may have one or the other or switch between the two. Tell your healthcare team if you have diarrhea or constipation. Your healthcare team can prescribe medicines to help prevent and manage both. Talk with your healthcare team before you take any over-the-counter medicines. If you have diarrhea, drink at least 8 to 12 glasses or 2 to 3 liters of non-alcoholic, mostly non-caffeinated fluids each day to avoid dehydration. Also, increase your intake of foods high in potassium and sodium. Avoid high-fiber and high-fat foods. The brat diet helps to thicken your stool. This diet includes bananas, rice, applesauce, and toast. Eating these items may help with symptoms of diarrhea. To help with bowel management, over-the-counter medicines are available for both diarrhea and constipation. For diarrhea, if you do not have a fever, take Imodium. Follow the directions on the label. If you do have a fever, talk with your healthcare team before taking Imodium. For constipation, take a laxative, such as Senna or Senecot S, with or without Docusate. Follow the directions on the label for all over-the-counter medicines. Also, follow any specific instructions from your healthcare team. If you take ondansetron, Zofran, for nausea, it may cause constipation. You can take a laxative when you take Zofran. If you're experiencing constipation, some changes in your eating habits may help. Eat meals at the same time each day. Drink lots of fluids and increase your fiber intake. A well-balanced diet with good fiber and fluid intake helps with bowel management. You can find a complete list of foods to include and avoid in your chemotherapy guide. If you have 4 or more loose bowel movements in one day, call your healthcare team. If it is after clinic hours, go to the nearest hospital emergency center. If you are constipated and do not have a bowel movement for 3 or more days, call your healthcare team.